So here we are at the Upper Beaconsfield GP Practice. Obviously, COVID virus is still something very, very important, but it's also important that you come into your local doctors and continue with your checkups. So I'm here today, we're going to go through and get our checkups and make sure that not only am I healthy, but make sure we get the right message out to the community. Puneet, good to see you.
Same here.
We're not allowed a handshake anymore.
Have a seat, please.
Thank you very much. Now, we're up here with Puneet. Puneet, why is it important that people still come in and meet their GPs face to face?
I think we mustn't forget that the chronic disease are still there, and the chronic disease they kill more patients than COVID kills or has killed. There are hypertension, there's diabetes, there's other heart diseases which needs to be checked regularly. And if people are not getting checked, then they're putting themselves at risk.
So it's really important that they can contact you. I know they've got their phone numbers we'll put up on the screen, but to make sure they can come in and see you face to face. Some of these consultations can't be done over the phone.
Yeah, and we understand that, and we're trying to minimize the patient contact as much as possible. So we have offered telehealth as well. We can do a video chat. There's a very secure line where we can actually chat them face to face on a video chat, and we can do some little bit of examination on the video chat as well. So yeah, the option is there.
Okay. How would you do like a blood pressure check? Is that something you need to be face to face with?
That needs to be face to face. But most of the patients they have blood pressure machines at home, so we can actually get those readings. And sometimes they need blood tests, they can go somewhere else, or we can do them over here. But yeah, for some examination, they do need to come in, and we try our best to minimize any kind of patient contact, and we obviously maintaining social distancing here, as you can see. If you're checking the blood pressure, I put the blood pressure machine over here so that we're not coming close to them. So, and if you're coming close to them, I always make sure that I'm wearing a mask. So yeah, we're doing all the things.
As an example, we'll do our blood pressure test if that's all right. So that way we can actually show people. Because social distancing is something that does concern people. But as you've said, even though COVID virus is still very much within Victoria and Australia, it is important they continue their checkups. And these checkups can be done safely. And I think it's a reminder to the community that you can still come in to your local doctors and get these done in a safe way. Obviously here up at Upper Beaconsfield, they've got the process in place to ensure that they'll protect you. Now, I've been told by Puneet, I've got to be very careful, if I'm talking whilst this has been done, it can adjust it. So this is only just to show you how it all works. But Puneet, what hours do you open up here in Upper Beaconsfield?
We open from 8 o'clock till 5 o'clock, Monday to Friday, and Tuesday we open till late till 7 o'clock, and Saturday we open from 9 to 2.
Oh, fantastic. So you've got plenty of hours. I know you've been very accepted up here. We had the pleasure of coming up here and opening up here. How long has it been now?
Nearly 16 months, I think.
16 months since they opened, and they've been very accepted within the community. People were looking forward to having a doctor up here. Puneet, thank you very much for your time.
And your blood pressure is high.
And my blood pressure is high. There you go. I should have stopped talking. I talk a lot as a Member of Parliament, but it is important. The reminder out there, make sure that you get to your local doctors and get checked up.